All right. Let's jump into this deep dive. And what we're looking at today is something that you're curious about, electroacupuncture for eczema. And you've sent over a really interesting set of research here. We've got systematic reviews, we've got meta-analyses, even some randomized controlled trials. So you really want to get to the bottom of this. Does this treatment actually work? And maybe even understand a little bit of the how behind it all.
It's a fascinating area, isn't it?
All right.
This kind of blend of ancient practice with modern science. It really seems like something that more and more people are looking to find that combination.
Totally. So before we get into the electric part of this whole thing, maybe let's just take a step back for a minute. You've probably heard of acupuncture, but how much do we actually know about how it's supposed to work?
Well, the basis of it is in traditional Chinese medicine, and the
Yeah.
idea is that your body has these pathways called meridians. You can think of them like energy highways.
Okay.
And there's energy or chi that flows through them.
Okay, I'm visualizing these energy highways all through the body.
Yeah.
So where do the needles come into this?
So the idea is that when those energy highways get blocked or the flow gets disrupted somehow, that's when you start to have problems.
Okay.
You can think of it like a traffic jam causing everything to back up.
I like that analogy.
And so the acupuncture needles, when they're placed at very specific points along these meridians, they're thought to help clear those blockages and get the energy flowing smoothly again.
So it's like the needles are these tiny little tow trucks clearing those energy highways.
Exactly.
I love it.
And when it comes to eczema, the thought is that the inflammation, the itching that you experience, could be related to disruptions in these energy pathways.
Interesting. So then how does electroacupuncture fit into all of this? Is it just a supercharged version of acupuncture?
You could think of it that way. Basically, you're taking those needles and you're attaching electrodes to them and then delivering a mild electric current through them. So imagine giving those little toe chucks a little extra boost to clear those traffic jams faster and more efficiently.
Okay, I'm with you so far. But, like, does this actually work? Does zapping these needles with electricity actually help with eczema? What does the research say?
Well, there was a meta-analysis that was done in 2019. They published it in a journal called Acupuncture in Medicine, and they looked at several studies. And what they found was that acupuncture could be even more effective than conventional medicine in reducing the severity of eczema.
Really?
And they measured this using what's called the EESI, which stands for Eczema Area and Severity Index.
Okay, more effective than the typical creams and all that. What is this ESI?
Basically, it's a scoring system that doctors use to assess how bad your eczema is. So they look at things like how much of your skin is affected, how red and inflamed it is, how itchy it is, how thick the skin is, and the areas that are affected. And the higher your ESI score, the more severe your eczema is.
Okay, so that makes sense.
Yeah.
So acupuncture, or electroacupuncture, I guess in this case, was actually better at bringing those scores down.
That's right. And not only that, but the studies also showed that acupuncture significantly reduced the itching, which, as you know, can be one of the most just unbearable parts of having eczema.
And you're constantly scratching.
Exactly.
So were there any like specific acupoints that were found to be more effective than others when it came to treating eczema?
There are a few key ones that come up in the research, like Li4, which is located on your hand between the thumb and index finger, Li11 at the bend of your elbow, and SP10 on your inner thigh. And these points are often used for eczema because they're thought to influence the flow of energy in pathways that are really closely connected to the skin and the immune system.
Okay, so it's like a personalized energy highway map for your eczema. But how does this actually work? What's going on under the hood when those needles get stimulated?
That's where it gets really interesting. The research is suggesting that electroacupuncture could be influencing the release of something called dynorphin, which is a natural painkiller and anti-inflammatory. And so that can help explain why it seems to reduce both the itching and the inflammation associated with eczema.
So it's like the electrical stimulation is triggering the body's own natural healing processes in a way.
Exactly.
That's pretty cool.
And there's also some speculation that electroacupuncture might be influencing something called the vagal adrenal anti-inflammatory axis, which is a very fancy way of saying that it affects the communication between the brain, the vagus nerve, and the adrenal glands, all of which play a role in regulating inflammation in the body.
Okay, so it's not just about stimulating those local points on the skin. It seems like electroacupuncture could actually be having a much broader effect on the nervous system and the body's overall inflammatory response.
Exactly.
That's fascinating.
But it's important to note this is still an area of active research. While the initial findings are promising, scientists are still working to fully understand all the mechanisms involved.
Well, I am definitely intrigued. So far, it sounds like electroacupuncture could be a real game changer for people with eczema. It seems like it could be more effective than conventional treatments at reducing the severity and the itching. And it might even be tapping into the body's natural healing mechanisms to do so.
And that's just the beginning. Electroacupuncture is actually being studied for a whole range of other conditions as well.
Right.
There is growing evidence that it might be helpful for everything from chronic pain and anxiety to digestive issues and even obesity.
Wait, hold on. Electroacupuncture for obesity. We definitely need to unpack that one. But first, let's dive a little deeper into what an actual electroacupuncture treatment for eczema would look like.
Yeah.
What can someone expect when they walk into an acupuncturist's office?
So if you do decide to explore electroacupuncture for your eczema, the first step is really to find a qualified and licensed acupuncturist.
No.
And they'll start by asking you a lot of questions about your eczema. You know, when it started, what seems to trigger it, what treatments you've tried in the past, that sort of thing. And they'll also ask you about your overall health history.
So it's not just like they're focusing on the eczema itself. They're really trying to get a sense of, like, the whole picture.
Absolutely. Traditional Chinese medicine really emphasizes treating the whole person, not just the symptoms.
Right.
And after they've talked to you for a while, they'll likely examine your skin. Look at the areas where your eczema is flaring up.
So it's not just like a one-size-fits-all approach. It really is tailored to each individual person.
Exactly. And based on what they learn from you and their examination, they'll then choose specific acupoints to target with the needles. We talked about a few common ones earlier, but there are actually hundreds of acupoints all throughout the body.
Okay, so they place the needles, then they attach the electrodes. But what does it actually feel like? Is it painful?
Most people describe it as a very mild tingling or buzzing sensation, right, where the needles are inserted. And the intensity of the electrical stimulation can be adjusted to make sure that it's comfortable for you.
So you're not getting, like, jolted by electricity or anything?
No, not at all. It's usually a very gentle sensation.
Okay.
The needles are typically left in for about 20 to 30 minutes while the electrical stimulation is applied, and some people actually find it so relaxing that they fall asleep during their treatment.
Oh, wow. That's a good sign. But how many of these sessions do you think people would typically need to start seeing results?
It really varies depending on the person and the severity of their eczema. Some people might notice improvements after just a few treatments, while others might need several weeks or even months of regular sessions to see a lasting difference.
Okay, so there's no magic number. It's really a process. It sounds like it requires some patience and some consistency.
That's right. And it's important to remember that electroacupuncture isn't necessarily a cure for eczema. It's more about managing the symptoms and improving your quality of life.
Okay, that makes sense. And I imagine it can be used alongside other treatments too, right? Like if someone's using topical creams or medications.
Absolutely. It's often seen as a complementary therapy that can work together with those conventional treatments. So it's really about finding what works best for you as an individual.
So to recap, it sounds like electroacupuncture is a pretty promising option for eczema. It can potentially reduce the severity, the itching, possibly by triggering the release of these natural painkillers and anti-inflammatories. And overall, it's a pretty safe and relaxing experience.
Exactly.
You mentioned before that electroacupuncture is being studied for other conditions as well, including obesity. That one really piqued my curiosity. How could sticking needles into someone help them lose weight?
I know it might sound surprising, but there's actually some pretty intriguing research suggesting that electroacupuncture could influence parts of the brain that control appetite and cravings.
Wait, hold on. You're saying that, like, stimulating certain points on the body could affect how our brains respond to food?
That seems to be the case. There was one study that was published in the journal Healthcare in 2024, and they looked at the effects of electroacupuncture on brain activity in people with obesity. And what they found was that electroacupuncture could actually change the activity in brain regions that are associated with things like dietary inhibition and emotional regulation.
Wow, that's pretty mind-blowing. So are you suggesting that electroacupuncture could actually, like, help people control their cravings
Yeah.
and make healthier food choices?
That's one of the hypotheses that's being explored. Researchers are also looking into whether electroacupuncture can help reduce stress-related eating, which is obviously another big factor that can contribute to weight gain.
So it's not just about suppressing appetite. It's also about, like, managing those emotional and psychological factors that often drive people to overeat.
Exactly.
This is all very exciting. But, I want to make sure we're being responsible here. I'm sure there's still a lot we don't know about the long-term effects of electroacupuncture for obesity.
Absolutely. While the initial research is promising, we really need more studies. especially large-scale clinical trials, to confirm these findings and really understand both the potential benefits and the risks.
Right, as with any kind of new treatment or therapy, it's important to approach it with both enthusiasm and a healthy dose of caution. But it's definitely fascinating to see how electroacupuncture is being explored for such a wide range of conditions.
It really speaks to the potential of this ancient practice to address a whole spectrum of health concerns in a very holistic and personalized way. And the beauty of it is we're constantly learning more.
Speaking of learning more,
Yeah.
you also mentioned that electroacupuncture is being studied for chronic pain. That's another area that affects so many people. What kinds of pain conditions is it showing promise for?
Researchers are looking at its use for everything from back pain and neck pain to headaches and arthritis.
Hmm.
Some studies are suggesting that electroacupuncture might be able to reduce pain intensity, improve mobility, and just enhance overall quality of life for people who are dealing with chronic pain.
That's huge, especially given all the concerns about opioid addiction and the need for safer, non-addictive pain management options.
Exactly. Electroacupuncture could be a really valuable tool in the fight against the opioid crisis, offering a natural and potentially very effective way to manage pain.
And what about mental health? You touched on anxiety earlier. Are there any other mental health conditions where electroacupuncture might be beneficial?
There's a growing body of research looking into its potential for treating things like depression, post-traumatic stress disorder, or PTSD, and even addiction.
Wow.
The thought is that electroacupuncture might be able to help regulate neurochemicals in the brain that are involved in mood anxiety and stress responses.
So it's like a natural mood booster and stress reliever.
In a way, yes. But it's important to emphasize that electroacupuncture, it's not a replacement for conventional mental health treatments like therapy and medication. It's more of a complementary approach that can potentially enhance the effectiveness of those treatments.
So it's about providing people with as many tools as possible to manage their mental health and improve their overall well-being.
I couldn't agree more.
And the more we learn about the potential of electroacupuncture, it really does seem to offer this incredible bridge between ancient wisdom and modern science.
It does.
Speaking of ancient wisdom and modern science, I'm curious to know a bit more about the digestive health benefits you mentioned. How could electroacupuncture possibly help with conditions like irritable bowel syndrome or IBS? And Crohn's disease. So we're talking IBS, Crohn's. I mean, these are conditions that can really impact someone's life. What's the thinking behind using electroacupuncture for these types of digestive problems?
Well, the research suggests that electroacupuncture might help to regulate the movement of food through the digestive tract. So kind of like getting that traffic flowing smoothly again. But in your gut this time, it may also help to reduce inflammation in the gut, which is obviously a key factor in conditions like Crohn's disease.
So less discomfort, less inflammation. It sounds like electroacupuncture is aiming for a more balanced and harmonious gut, which makes sense given its roots in traditional Chinese medicine.
Exactly.
But, I have to ask, not every study we've looked at has shown positive results, right? Still all we don't know.
Absolutely. There is still so much to learn.
But even so, the range of conditions that electroacupuncture is being studied for, it's pretty impressive.
It really is. I mean, we've talked about eczema, obesity, chronic pain, mental health, digestive disorders. It seems like every day there's a new study exploring its potential for something else.
Speaking of research, I'm curious, what are some of the challenges that scientists face when they're studying electroacupuncture? I imagine it's not always easy to design these really rigorous studies for something like this.
Yeah, you're absolutely right. One of the biggest challenges is the lack of standardized protocols. Different studies use different acupoints, different frequencies and intensities of stimulation, different treatment durations. It's kind of like trying to compare apples and oranges.
So how can we make sure that we're comparing apples to apples, so to speak?
Well, we need much clearer guidelines and standardized protocols for electroacupuncture research. That would help ensure that studies are replicable and that the results are more reliable.
And what about the placebo effect? I mean, that's always a tricky thing to account for in any kind of medical research, but especially with something like acupuncture. Do researchers know that they're measuring the real effects of electroacupuncture and not just the power of suggestion?
Yeah, that's a great question. To try to address that, researchers often use something called sham electroacupuncture.
Sham electroacupuncture.
Yes.
What is that?
It's basically a placebo treatment. So needles might be inserted at non-acupoints, or the electrical stimulation might not actually be delivered. And so by comparing the results of real electroacupuncture to sham electroacupuncture, researchers can get a better sense of whether the effects they're observing are truly due to the treatment itself.
That's clever. It's like a scientific detective story, trying to isolate the true cause and effect. And, of course, we always have to consider the ethical implications of any kind of medical research.
Of course.
We need to make sure that these studies are being conducted safely and responsibly, with informed consent from all the participants.
Absolutely.
So it seems like we need to move forward with both enthusiasm and caution, acknowledging the incredible potential of electroacupuncture, while also being mindful of the need for rigorous research and these ethical considerations.
I completely agree.
And it's also important to remember that electroacupuncture, it's not like a magic bullet. It's often most effective when it's used as part of a more holistic approach to health and wellness. Alongside other therapies and lifestyle changes, it's about empowering people to take an active role in their own health, providing them with a diverse toolkit of options, and really supporting them in finding what works best for their individual needs.
Well said.
Well, this has been a truly electrifying deep dive into the world of electroacupuncture. We've explored its ancient roots, its modern applications, and its potential for treating a wide range of conditions, with a special focus on how it might be able to help you with your eczema.
It's been a pleasure exploring all this with you.
And until next time, keep those energy highways flowing. And remember, knowledge is power, especially when it comes to your health.